make a shift into these industries? Do we need additional skills to penetrate into these industries? And a lot of questions that people ask. It's very hard for you to move between industries and select which one would be better in this recession. Healthcare, growing industry. Everybody gets sick all the time. What would be some of the career options that one can have on the non-clinical side that may require either no additional training or minimal training?
There's all kinds of positions within healthcare, both clinical and non-clinical, that are, and it's an entry-level position, and often people go into them either because they're first starting out in their work life, or they've made a decision to change their career. And so in either case, the types of positions, let's say, I want to start with clinical first. If you think you're interested in patient care, but don't have a clinical degree, you could start out as a patient care associate. And these are people that assist the nurses directly with patients on the unit floors. The requirements for that position are a high school diploma and an attitude, a service attitude, service and safety. We screen heavily for that, and as does all healthcare organizations, because the most important aspect of anyone's job in St. Luke's really is their service and care for the patients. Faithful, loving care is I guess the methodology that we would like everyone to follow in performing their jobs. Other entry-level positions, monitor tech, again takes a high school diploma and an aptitude. There's some basic testing and I guess attributes and competencies that we would look for, communication skills and so forth. And we do have people that have decided they want to go to either nursing school or seek an allied health career, which would require, in either case, at least an associate's degree. And then some of those positions, as you move up the ladder, would require a 4-year degree. But St. Luke's, just like many other organizations, after you've worked there for 6 months, you can get tuition reimbursement. And, that's a nice way to work your way through school. As far as non-clinical positions starting out, if you're interested in, well, there's all kinds of, from working with patients, learning about patient registration. Now, those generally take a little bit of experience, but there's all kinds of clerical and clerical support positions for people first starting out. And we have people that have college degrees that have worked in other areas that just say, I want to make a change. And so if you like the passion, a passionate environment, and an ever-changing environment, it's probably the most dynamic industry you could possibly be in.
As much of a downturn financial industry has seen this year, one place I've seen a huge voluntary turnover is in this industry. This tells me that financial advisors are still able to make those decisions to select the type of organizations that they want to work with.
I've been with Prudential for about 2.5 years, but I've been doing work around recruiting and sourcing and diversity for many years. I want to read you a couple of numbers because I think that will help me make my point. There are 78 million baby boomers controlling $17 billion worth of wealth. Okay, so the first wave of them will have turned 60 in 2004. So that means they've got money that needs to be managed. They've got money that they need to hold on to. They've got money that they need to grow. So who's going to manage that? The second point is companies, big companies, are taking away 401k plans. They are they're cutting pension plans. And employees are having to manage more of their money. They're having to contribute more dollars to their health care. So take those two things, right? And the average financial planner, financial advisor is about anywhere between 52 and 54 years of age, white male. So in about 10 to 12 years, those individuals are going to be retiring. So what's going to happen, right? You've got folks getting older and older, people are living longer and longer, they need to manage their money. So we've got more money to manage and less people to help us manage it, right? So what does that mean? That means that we need more financial advisors, financial planners. If you are really good, you can hop from company to company. Companies are merging, they're closing, and if you're good, everyone wants you. So that's why you're seeing people who are hopping, who are still getting bonuses. It's an amazing profession to be in, especially now in this economy.
I know so many recent graduates that said, I'm not even going back into the market, I'm just going to go do either another degree or go do continuing education or even higher education. Do you see an increase in enrollment? And because of this, do you see that there is a huge demand for teachers and instructors at Houston Community College?
This is the spring semester of 2009, and we are seeing the highest enrollment of students ever at the Houston Community College. We now have over 60,000 students enrolled in all of our 27 campuses throughout the city of Houston. That tells us that when the recession happens, people go back to school to redefine themselves and to find another career. And for those who always have wanted to follow the career that they wanted to choose, but at the younger age, they were determined, like my parents have, go to where the jobs are at the easiest. So back to your questions, yes, we do have many students coming back to school and trying to get a second career. In terms of we are always hiring. I have yet to determine that with HR in terms of is there a demand for teachers. There's always a demand for instructors. We have more adjunct professors than there are full-time professors at Houston Community College. In my role, I oversee all the international partnerships for HCC throughout the world. And by the way, Prudential is very, very have a high presence in Vietnam, Ho Chi Minh City, where one of our affiliated school is at. So congratulations. I'm always looking at the demands from abroad coming to us and wanting to look at the career choices for their students. And what I'm always seeing from countries as far as Saudi Arabia, South America, or in Asia, first of all, is always business administration, IT, and healthcare. And those are the three areas that we still see very much in demand here among our students as well. Before coming here, I wanted to just check and make sure that what are the qualifications for our instructors. There are, in terms of academics courses, these are courses that would allow for students to gain a 2-year degree and transfer to a university. The professors that the credentials that we require for these academic classes is a master's degree of that discipline, or a master's degree of the related discipline, and 18 hours of graduate hours of that particular discipline that the person teaches.